The Coalition's mission is to promote effective interchange among patients, families, and healthcare professionals and payers to ensure the provision of patient-centered care.
So supportive care, to me, or palliative care, really means making the patient the center, making sure that we are focusing on the patient's most pressing needs, and that we are making decisions that really incorporate what gives the patient a quality of life, what makes the patient happy. I have fellows and medical students rotate with me, and they are amazed that some of my office visits are spent just with one question saying, does your life have the quality that you want it to have? What makes your life have quality?
So what do the patients need? What are their desires? What are they bringing to the table? It's what are the behaviors of the providers, the things that they've learned and been trained with, and trying to change their attitudes and beliefs and behaviors. And then we're working within a healthcare system, and dialysis centers are unique in the way that they provide care compared to an outpatient clinic or acute care hospital. There's just so many aspects and things to consider. We work within a Medicaid system or health insurance system that also provides unique barriers to overcome as we look at implementing this work. And so when you look at all of those factors, you have to systematically consider how you make change within these systems. And so that is really what implementation and translational health sciences is about, and really the next frontier of how we learn how to innovate in healthcare.
So I think that in terms of what has to be different for the care of people with advanced kidney disease right now is that we have to really take the time, and many nephrologists do this, and just to make it more of a standard, to take the time to really explore what's most on the patient's mind when they are facing these difficult decisions about dialysis.
Nurses also engage the loved ones in this conversation as well to prepare them for the eventuality that it's possible they may be in a place of making decisions for their loved one. And they need to understand what that is. They need to understand what it is the patient wants or doesn't want. And ideally arrive at a consensus around that within the family long before the need should arrive, if it does.
We're dedicated to improving the lives of kidney patients by providing patient-centered supportive care education, best practices, implementation, and technical assistance to kidney care teams across the United States.
So along those lines, what do caregivers need? And I think caregivers need just as much information and support as our patients with kidney disease. Caregivers need to receive the information in a clear and easy to understand manner. They should be able to engage with us as clinicians, ask all the questions that they need. And importantly, I feel that clinicians need to be in the room when we're having our conversations with patients. It's very surprising to me sometimes to see patients and caregivers who have known each other all their lives, for instance, like a married couple who are maybe in their 80s and they've never had conversations about dialysis or no dialysis, or, do I want CPR or do I want mechanical ventilation? And so I feel as a clinician, my goal is to meet the need of the caregiver by just being a support for them in these conversations and making sure that things are communicated effectively, and again, that we're engaging in shared decision making.
One of the biggest things that I've seen with Pathways is learning how to be comfortable with conversations that are difficult, and that I've learned things that have helped me have conversations with my kids and with my husband and with people that I interact with, because it's really about learning how to listen. And that's a skill that we all can use as people, but also as healthcare providers, especially when working with patients with end-stage kidney disease.
I hope that the tools that we're developing and the research that we're doing is going to provide people with the best care, and that we can help distribute these tools and resources so that everyone has equal access.